Healthcare in senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Good afternoon, Brian.
Hey, Joe.
We have a great show. We have a great guest. We are talking about the death doula movement, or the end of life doula movement. And we have an awesome guest today. His name is Peter M. Abraham. He is an author. He's written 50 books. He's a registered nurse. And I found Peter on LinkedIn, this book that he had just published, and I just was like, I'm going to order that book today. It is on the death doula, becoming a death doula. So I have been a hospice nurse for years and was just intrigued by what is a death doula. And so I took a course and just learned a lot about it. Love to have that as a credential. I just love working at end of life. And Peter, you are just so knowledgeable, and we are so honored to have you as a guest today. So we are going to be talking about the end of life doula. And tell us, how did you get involved?
So I got involved in the end of life doula movement. I guess you could say from the perspective that as a hospice registered nurse, I had an opportunity to work with a very small handful in York, Pennsylvania. And they always ended up having better patient outcomes when they were involved compared to when they weren't. So then when our family moved from South Central Pennsylvania to Central Kentucky, and here, even though the nursing shortage is as bad as it is in Pennsylvania, the mindset is if you want to work part-time or PRN, they're looking for 12-hour shifts only. And in Lexington, Kentucky, the one organization's looking for 13-hour shifts. I'm at a place in life where I don't want to go down that road. So I started looking at death doula as a way to stay connected to those who are in very dark and difficult times and actually do more from a point of view than what hospice is capable of doing without competing with hospice. So that's what started the journey.
Peter, I'm going to back you up for just a second. You said something interesting. You said you got to see as a hospice nurse that there were cases where they had a death doula on them and cases that did not. And you said the outcomes were superior with those with death doulas. What did you see specifically in those cases with the doulas that were like, wow, this is a very different outcome or a much better outcome for here?
So with the understanding that like every nurse is different. And so I'm the old, even though I'm a second career nurse, I'm old fashioned, that I want my patient and families to have a thorough understanding, like here's what to expect next without overwhelming them, and have them understand the meds and everything else. Not every nurse is like that. And so when you're working with the family, a lot of times there'll be two or more nurses involved in a case. You'll have the case manager, but if they can't see the patient, maybe they have an admission to do or something else, another nurse goes in. And their standards for how they educate the family sometimes are not existent or on the lower end. And sometimes it's not them. Sometimes it's that they got too many people to see. So those families that had the end of life doulas were better prepared. They had the education reinforced. So like for this one family that was in a very rural area, I walked in and they were already aware of like body positioning and gravity is more effective than the medications when it comes to the secretions. They had them spiritually prepared, like in this family's case, have a window open, have doors open. That's what meant something to them. And that's, when we talk about like what matters for comfort, it's not always are they suffering from a pain perspective, but we want to cover their emotions, their spirituality, and all the different domains. And this doula this was a female doula. She did her job well and she took it seriously. So the family was extremely prepared, made my job easier as a nurse.
Interesting.
And
okay.
That's what I saw time and time again when they're involved, the difference that they make when they're reinforcing and teaching and helping in that area.
Gotcha.
Yeah.
Okay.
And Peter, I was a hospice nurse back in the 90s. And when we had a caseload of maybe 12 to 15 patients max, and if someone were in the dying process in those final hours, they would just say, Joe, you take care of that patient. We'll handle the others. And literally a chaplain, the social worker, myself, an aide, we would all be at the bedside. And it was wonderful. I mean, we were really able to educate and comfort and explain. But today, there are nurses that see a patient one time a week. And if the family member that needs the teaching is not there, maybe she's at work, the daughter's at work, a lot gets lost in translation, and a lot wind up calling 911 because they don't know what to do. And, I was trying to explain to Brian, it's kind of like the L&D, when you go into labor for the first time, for me when I went into labor, I had no idea what was going to happen. It was terrifying. But, with my second and third child, it was easier because I knew what to expect. But we have to think about these families. For most of them, it's new territory. And if there's no time for education, what better, money spent than finding a doula to help guide them along the way? And I don't know how many hospices you guys have in Kentucky, but we have almost 300 in Dallas. There are a lot of hospices. There are a lot of nurses that are on call, a lot of nurses that are in the field, and they're not getting trained like we were years ago. So just, it's sad.
So in your experiences, the doula piece of it, that is a separate component for hospice, correct? So this would be like somebody that you would pay for privately to be there in addition to hospice. Is that how this typically works?
So it's a very good question, Brian. The doula is independent of hospice.
Okay.
So some hospices, like there's I think 2 hospices, maybe, I don't know them by name, in San Antonio, Texas, that actually hire end-of-life doulas to be a part of their program. But there are, in many situations, the doula is completely independent.
Okay.
And there's a lot of, even though the doula movement has been taking off even more so since COVID, it's still in such fresh territory that hospice and palliative care doesn't always know what to make of doulas. Yeah. Like they think we're the competition to what they're doing. And then there's families when part of the reason I started, instead of saying I'm an end-of-life doula, I'm a life transition support guide, or you could say coach, is, I don't need hospice. No, I mean, in my case, I'm a nurse, so I know the medications and so on, but that would be its own kit and caboodle, so to speak. But some hospices are like, you're competing, or we got volunteers that can do that. But it's not the same thing. But we are private pay. There are agencies, like there's a Virginia Death Collective, Crystal, and I don't have her last name memorized. She's one of the founding members. Their team's working, and other collectives are working to how do we get recognized by the government that we could bill Medicare, Medicaid. That's its own 9 yards past what you asked. But we're independent from hospice.
And you guys are really focused more on the non-medical side, if I understand it correctly, right? So think of it in terms of like, it's more of a holistic approach to not just the patient themselves, but also the family members, but strictly non-medical, which is why there's no competition with the hospice, because you guys aren't doing anything on the medical side of it. It's looking at the bigger picture, all these other things. Because I'm a therapist, and as much as I like to claim that we try to take a much more comprehensive approach. There's still things that there's certain things that are kind of in our wheelhouse that we have an expertise in, and other things just are not. And so I think that's where you guys can be benefiting the patients on hospice and those family members, because it is looking at it not strictly from the medical side, but from the non-medical side.
So question, we have had patients that want to go on, have a end-of-life doula, but they do not want to use hospice, almost like a concierge. Have you had that experience in Kentucky too, that rather not have hospice?
Not in Kentucky yet, But what I have done from a remote perspective is, have either of you heard of VSED, voluntarily stopping to eat and drink?
Yes.
Okay, so there's a person that I'm remotely helping as an end of life doula, that's in an area where this person is not able to get a hospice provider to even accept them as a patient. They're not terminally ill. So they have a chronic illness that they're just at the ends rope of, I can't take this anymore.
Aww.
And so they're going down the route of VSED, and there's not even though they're in a highly populated state that has sections that are heavy with doulas, in their area they don't. And so myself and I think another end-of-life doula by the name of Mallory is trying to help this individual to walk down it's a heavy choice to make, to voluntarily stop eating and drinking, because you still have the body motivations. You're not terminally ill, where the terminal illness is pushing you further along to eat and drink less naturally.
Yes.
You don't have that naturally happening. So it does take a lot of strength to say, I'm not going to eat and drink anymore, but those people still need support.
Wow.
We had that here in Dallas. We had a patient that we took care of that stopped eating and drinking. And it was challenging. It was hard.
Yeah.
It was hard.
I think they were on hospice though. So
they were on hospice.
There were some medications that could be used
and a
to
doctor
help.
prescribed pain medication and made that a little easier, but it was definitely hard for friends and family. And so tell us about where we can get your books.
So I self-publish on Amazon.com. And so if you were to look up for Peter Abraham, you are going to see science fiction authors, but like you mentioned, Becoming a Death Doula. So that would be this one here.
Okay.
And so just if you go to Amazon.com, but I'm a geek. So I love learning. I love researching how to do things in the best method possible. So to just give you an example of two of the books that are in that series, it's the Bridges to Eternity series for end-of-life professionals. That includes doulas, social workers, anyone working in the end of life. A lot of what we do centers around how to help the family and the caregiver, not just the patient. So one of the aspects is creating meaningful legacies. Now, there are hospice providers that will do this. You might know, like shadow boxes, or they'll do, photograph albums and so on. So part of my book writing is, what else is out there? And when I did research as to how can I do better at offering my families legacy options, there's nothing written. I go out on the web, here's 9 projects, here's 10. So I ended up crafting meaningful legacies, where it's like 50 project ideas. But what makes it different, if you both probably heard of SMART goals: specific, measurable, attainable, realistic, time specific. All of these goals are, here's the timelines, materials, here's how to implement it. And that's all in chapter 3. But then chapter 4 forward is, if the hospice is saying they have 6 months to live, here are project ideas. If the hospice is saying 1 month, here's different ideas because it's time specific. And then 2, like planning a vigil, how to plan and execute. And then I do have one coming out. I don't know if it'll be this week because our daughter is visiting from Pennsylvania, but I'm coming up. I have the book written. It's in final draft format for crucial end-of-life conversations dealing with the topics. I love Barbara Karn's books, so please pardon me for being over and all, but she has the Gone From My Sight.
Okay, yeah.
We had her speak in Dallas a couple of years ago.
Yeah,
she's great.
She's an amazing lady. But these books are written for the family that's particularly in crisis. So she's writing at the 5th grade reading level. And I want to write books to support my end-of-life professionals, especially doulas, as to how do you really go in without overwhelming. I'm trying to write at the 8th to 10th grade level, but how do you share with the family about, don't force food? Like I still remember the daughter who didn't get, like if there was a doula involved, this may not have happened. Or maybe the nurse needed to do more education. Sometimes you have to hear it like 12 times. It's like advertising. You have to hear it 7 to 12 times before it really sinks in, because these family members are already under tremendous stress. Their loved one is dying. And so this daughter goes in and didn't ask the facility, but was trying to feed mom, and mom's near the active dying phase. Mom aspirated. And while I'm not big on numbers, her pulse ox dropped to under 20%. And now she went to where she had a few weeks to live to now where she's dying now.
Yeah.
And had a doula gone in and have been present and reinforce all that education, it just, the outcomes are so much better. In fact, the book that I wrote reference, I'm not gonna try to pronounce the doctor's name that wrote the book, Being Mortal. So he was involved with a study that if you have these end-of-life conversations, you could actually prolong life by as much as 25%.
Oh, wow.
Wow.
So on a 6 month, to put that in numeric perspective, if somebody has a 6 month prognosis, that's now 7.5 months.
So tell us, say somebody's interested in becoming a doula. They have no healthcare training. They've bought your book. They're intrigued. What is their next step?
So their next step, I share this. I try to be very transparent. So under the best route, you're going to be doing homework to find a school to go to. So I share as part of the book description for those books. This is not a replacement for going to I'm currently taking classes at the International Doula Life Movement. There's the International End of Life Doula Alliance. There's all these different schools out there, but it takes a lot of homework to find out what's the school that's best for you. And we could have a discussion of the catch-22 at certification. But if they bought the book, one of the routes, whether they buy the book or not, is go to the National End of Life Alliance, NEDA. And they have a membership for $50. It's annual. You pay that membership and they'll tell you on their site, give them 72 hours for your membership to be validated. They have an online study guide. Take the online study guide, you study, and then to take their proficiency badge for $115. They now, for a $165 investment, plus the book if they buy the book, they're now certified. And that's the most economical route. And part of the reason I ended up writing the book is I'm going to various webinars researching schools, and I'm not knocking the school in question that I'm going to talk about, but the presenter was saying after 3 hours of extremely wonderful education, last hours was a heavy sell. It's an $8,000 course, comparing it to going to RN school. But if you buy in the next 72 hours or so, 48 hours or so, it'll be $2,997. And I'm thinking to myself, the catch is I'm not trying to knock the value of the school. But the issue is there's people wanting to become a doula that don't have $2,997. Even if this is the best school in the entire world, and they want to be out there and they want to be practicing, there has to be a better way. And there were people in this Zoom conference that were putting in chat, I'd have to get a second mortgage. I feel my heart feels tugged. I want to do this. I'm desperate.
Yeah.
And I was like, and then I'm putting in the chat politely, I'm not knocking the school. I'm saying, go to NEDA. I gave them their website address, $50, $115, study the course. And I literally got kicked out of the gym.
Peter, it sounds like there's not really like a universal, like national, even state level certification or license for these things.
No.
Okay.
No. And that's the catch-22. Because I mentioned about being transparent, like my books don't replace a course. But when PT, RNs, CPA, even the CNAs, there's an accrediting body that says this is your floor.
Yes.
This is your floor. Now CNAs do go through skill tests, where I can't speak for a PT, but for LPNs and RNs, it's an education test to prove your knowledge level at the very minimum level. Like RNs is like you're not going to walk into a hospital and kill somebody your first day. But for doulas, there are some programs out there that I've seen. I don't have them memorized. That like this course will get you certified for $150, and it's like a day or two course. And there's other courses that are 17 weeks, and another course might be a year. But what you learn, like there's no guarantee like this is going to be enough.
Okay.
Well, and I found one, Peter, that was like $10,000, like a weekend retreat, and you'd be a certified doula. And that is crazy, because you've got to get the experience too. So
what's been your experience? So if I'm a family member and I'm wanting to put my mother or my grandmother on hospice, but I really feel passionately about, I really need somebody else out there like that's a doula to be out there with us to kind of help make things easier, transition easier, smoother, whatever. How do I, is there a set number of hours you guys do? Is there like a protocol for this? Is it just you're out there whenever we call you to say, hey, can you come do another visit with us? How does that usually structured?
So you're talking about the actual engagement versus the certification discussion?
Yes.
So the engagement, it's, since we're all private practice, we don't have any leading bodies or associations, which is both pro and con.
Yeah.
It is literally up to the end of life doula. Well, like for instance, for me, for my business offering, I'm doing care planning, which down the road will include advanced care planning. But for right now, care planning is the non-medical equivalent of a nursing care plan.
Okay.
Teaching caregivers, including the family members, how to do the proper non-medical support care, body positioning, fans, and so on to help with breathing, aromatherapy, and so on. End-of-life education as well as sitting vigil, but not necessarily 24/7, but like creating, like, let's create a team. I'll be part of the team. This is how many hours I can put in. And then everyone's different to what degree they're going to say, like some of the doulas I talk with, they are their own 24/7 person, and how they operate. I guess it depends on how many clients that they take on, to what degree that they can not overpromise and underdeliver.
Yeah, kind of like a care manager. It's really what you can handle. And some families want a lot more hand holding than others.
Okay.
Yeah. Okay.
So it's individual, I would feel.
Correct. And what, with the understanding I am biased, I'm giving you my bias. In my own investigation of like courses, because like the closest, there's University of Vermont has a program, but they actually will reach out to the International Doula Life Movement for instructional material. So I'm taking classes there, and most of their classes are under $1,000. I don't have their price list memorized, but they have been extremely thorough. And Brian, the hard part with answering questions for number of hours gets into everybody picks up the material at a different pace. So if you went by hours, it's not that your question is invalid. It's just the example I have is like I have my BSN. And I went through Capella University, and I completed my BSN in 6 months and 2 weeks. Because like I'm the geek, I'll put everything into it and I'll absorb it quickly. Where another person may need 3 or 4 times the number of hours.
Yeah.
But if I were to tell you like the hour mark, that doesn't necessarily equate. Do they know this well?
I got you. I think where I was going with that is if I'm a family, because Medicare will cover the hospice part of it, and this is what I didn't know is that some of these things that the doulas do, I thought hospice did, but it sounds like that's recently changed in the last few years or whatever. And so if you're needing to add this additional doula service or wanting to, and I'm a family who's got a budget or whatever, like what does that usually run? How many hours am I getting support for? I think that's where I was going with that.
Okay, so with that, to give you an example, and I cannot speak for Texas, McKinney, Dallas, and otherwise, but like here in Kentucky, you go to visit a site like care.com and look at what the private caregivers are charging in your geographic area, And in my geographic area, they're charging anywhere from literally below minimum wage, $10 an hour, up to $35 an hour. And in my own practice, while I do publish under my name, Peter M. Abraham, the company, the doula business I founded is Compassion Crossing LLC, and I'm going with $25 an hour is my base rate. Now that may change down the road, and I'm working it like on a sliding scale where if I have a family that, I can't afford $25, I do my intake with them. And one of the reasons I like the International Doula Life Movement is they really stress the entire process of growing your business from the very first phone call to the time of death. It's very complete and very thorough. And they stress, like, during the intake, you're finding out, is this a patient I can care? Can I excel their, like, tell them here's what I can do and then exceed their expectations. But if I get a family, it's like I know I can help them, but they can't afford me. This is me, my heart's for those that are hurting.
Yeah.
If I could do it for free or donation, one day I want to do a 501c3 nonprofit, and it's just I want to meet Kentucky standards, which is 3 to 5 board members. And since I just moved to Kentucky late last year, I don't have anybody that's warm enough that I have a solid yes for the board members.
No, I gotcha. Okay. I was just trying to get an idea of, like, for budgeting purposes, but $25 an hour, that seems extremely reasonable, especially if you're paying more than that for a caregiver.
Well, there are caregivers here in Dallas, some private, that charge almost $40 an hour. And that's just a caregiver.
So
there's such a demand. Yeah, it is. Okay. I think the going rate is $100 to $150 here an hour. I've talked with a firefighter, and she is in Austin, and she's a doula, and that's her charge is $100 to $150. But she said it keeps her busy on her days off, so she loves it. And that's the thing; anybody can do that. And right now with families, adult children are so far away. It's just a wonderful way. You've got somebody that's holding your mom's hand, holding dad's hand, and they're just getting more support. So I know you are going to be coming to Dallas this fall. We cannot wait. We don't have dates set up yet, but you're going to be coming and signing autographs and speaking for us, and we cannot wait for that. Is there anything else you'd like to share on your journey and just share with the listeners?
Two things come to mind is one, even though a lot of us will refer we're an end-of-life doula or a death doula, it is a lifelong journey. So there are those of us who do mainly advanced care plans, which are for anybody 18 or older. And you can say, I'm going to be, mom or dad or uncles or aunts, companions in a facility long before they get to a terminal state. Long before they get to be a terminal state.
Okay. And
that way you get more involvement. You can bridge palliative care. I know I'm going to jump through some rabbit holes over the 2 areas that I meant. I said I'm going to go 2 areas, but there are going to be rabbit trails. So, medical aid in dying is going across the country. And I like Dr. Andy. I'm not going to try to pronounce Dr. Andy's last name. He endorsed one of my hospice nursing books dealing with eligibility. But he and a number of other palliative care hospice doctors are on board, and I'm with them, that if palliative care is involved sooner, you may not even bring up medical aid in dying. And that's where doulas can be providing education too, because even though hospice is palliative care in the last 6 months of life, there does need to be a terminal prognosis. Prognosis is different than a diagnosis. Prognosis is how much longer does somebody have to live versus what do they have that's taking them there.
Yeah.
Well, palliative care is if they are receiving treatment that is uncomfortable for them, they could be involved providing that symptom management and comfort to the point where suffering is either non-existent or minimal, tolerable.
Yep.
And doulas could be reinforcing the education for the palliative care team. And so that's number one. It is a life journey from 18 to the time they die. And then number 2 is just reinforcing that if you have a heart to help people, you feel called, like I'm called to go and help people, but nursing school is not for me, or I appreciate what a CNA can do. I love my wife dearly, but she literally told me I don't want to wipe somebody's body part. But I'm trying to just use proper language. So this is for somebody like, how do I fit into this connection with other people in a meaningful way where I could be a blessing? Because I believe we're put on this earth for more than just living our own lives. We can bless other people, build our own legacies. So that when we, at the end of our life, and not saying we save ourselves, I'm not trying to preach, but like, what did we do with our own life? We could look back and see how many people's lives we touched because we stepped out of our comfort zone and walked into the life of another human being in a dark time.
Yep.
Love that so much.
That's great.
Well, I am encouraging listeners, if you want to become a death doula, get this book of Peter's, find out about courses. I took my course online. It was over a weekend. It was like $800 and it was wonderful. I loved every minute of it. I know everybody can't afford that, but there are some good ideas that you've given us for $50, $100. But thank you so much. This has been great. And, I encourage listeners to just volunteer. Hospices are always looking for volunteers, and see if that's actually something you want to do. You think you want to do, but just be at the bedside. See if that's really something that appeals and you feel like you really can give back. So
great. Thank you, Peter. We're looking forward to getting to meet you in person in a few months.
Yes, we can't wait. And thank you so much for your time. Keep on writing.
You're very welcome.
All right.
Take care.
Okay, bye-bye.
Bye.